name is Brenda. I will be presenting and demonstrating today how to set up a sterile tray for a clinical procedure called a cystoscopy. A cystoscopy can be defined as a clinical procedure where a scope is inserted inside of the bladder to identify if there is any lumps, bumps, lesions, or tumors. The most important thing when setting up for a clinical sterile procedure is that your area is sanitized. You can ensure that the person before you did their job and ensured that their area was sanitized. So what you must first start out by doing is cleaning your area with what we use, purple top wipes. We refer to them as purple top wipes. They're sanding cloth wipes. They are used to sanitize the area. We use them to sanitize all surfaces in the room that include the countertops, the door handles, the chairs, the exam chairs, and the Mayo stand. Moving forward, setting up the procedures to ensure that your bed is prepped. So this is the bed right here. You would set it up and put a drape over it. We'll put a Chuck's pad on top of the bed where the patient will sit, and then a drape for the patient to cover themselves, as well as a pillow. The supplies you will need for a cystoscopy is very generic. So you'll need a Mayo stand, a tray drape, a fenestrated drape, lubricant, lidocaine Urojet, which will be inserted inside the urethra of the patient, a 4x4 gauze, a cystoscope, a 10mm syringe, a 30mm syringe, iodine or Hibiclens, a sterile gloves, and an Enzodyne sponge. Here is the visuals of what those items look like. So this would be the syringes, the iodine, the sponge, the sterile gloves, the tubing, the lidocaine, the fenestrated drape, Mayo stand, the gauze, the Mayo cover, and the sodium chloride. When opening and setting up for your sterile procedure, it's important that you handle the packaging properly. So when opening the drape, it's important that the packaging is open and pried apart from each other so that it is not touched, and that could compromise its sterility. There is a 1-inch border around the drape that you are only allowed to touch. If you touch it inside of those borders, that could compromise the package's sterility. So next, once the drape is placed on the stand, then you're going to drop all your supplies. So you'll drop the lubricant, the fenestrated drape, the gauze, the lidocaine, as well as the tubing that will be connected to the sodium chloride. Then you will place the scope, you will put on your sterile gloves, grab the scope, and gently place it onto the stand. Once it is placed on the stand, then you will plug in the scope into this machine, and this monitor will allow you to look inside the bladder. We'll direct the patient to lay in a supine position with their undressed from the waist down. In the male patient, we will sterilize the penis with iodine. In the female patient, we will sterilize the vaginal area and the urethra with iodine as well. If the patient is allergic to iodine, we will use Hibiclens. So if the patient has an allergy to iodine or crawfish, we will use Hibiclens instead. So once the scope is inserted inside of the urethra, this is what it looks like. So this is a normal looking bladder, and right here, this is what can be identified as a tumor inside of the bladder. Once the procedure has ended, the scope will be handed to the medical assistant by the provider, where the medical assistant will then flush the scope with water and soap with the 10mm syringe and the 30mm syringe. The scope will be cleaned with this sponge, and it will be transported for sterilization. Then once the procedure is completed and everything is put away, then the whole area will be sanitized again. And that is how you perform a cystoscopy sterilely in a clinic.